Charting an antepartum note. The antepartum encounter note in Waiting Room Solutions has all of the data elements and charting convenience of the traditional ACOG antepartum forms. We enter in our chief complaint and HPI here. The standard gynecological history can be taken, including menstrual history, sexual activity, and pregnancy history. Genetic screening questions can be easily charted, and comments made. If the review of systems is normal, this can be charted quickly with a single click. Laboratory tests for the different stages of pregnancy can be viewed. WRS has bidirectional laboratory connections with all of the major reference laboratories, and lab orders can be easily sent and received. Trimester-specific educational counseling can be charted. Educational emails can also be sent to patients based upon their diagnoses and medical conditions. The WRS Patient Portal allows patients to enter their medical conditions, surgery, family history, etc., so that information can be automatically transferred into the antepartum note. Patient medications can be entered, including allergies. Medication interactions also display. Here we see a medical condition to medication interaction, which alerts us that Accutane should not be taken during pregnancy. Now let's enter the data for the antepartum flow sheet as typically seen on the ACOG form. On the antepartum flow sheet, the estimated date of delivery can be calculated based upon the last menstrual period, initial exam, ultrasound, or initial expected delivery date. From one visit to the next, the pertinent elements charting the progress of the pregnancy is entered. The information is now saved, and at subsequent visits, you can go back to the same note to enter the progress over the course of the pregnancy. I'll order the standard obstetric panel for the initial tests to be done in the first trimester. If you're electronically connected to a lab, the orders will automatically be sent. Otherwise, you can print out your lab orders on a requisition form or prescription. Here we see all of the tests in the standard obstetric panel. Under my assessment, I can enter my follow-up plans. Now let's view the note we just created. Now you can see all of the note elements displayed. Waiting Room Solutions also has a due date report function. This allows the physician to search patients' due dates based upon their last menstrual period or estimated date of delivery. In turn, the physician can have a printed report of all the patients that are due in a particular time frame, and can also be used when a physician is on call. The Waiting Room Solutions antepartum note gives you all the basic elements of a traditional ACOG note with enhanced functionality. It allows you to send out educational materials to patients, track medication history and medication interaction alerts. Ordered labs can be sent directly to the laboratory and entered into the chart, and the patient's pregnancy flow sheet and estimated date of delivery can be easily tracked and charted.